Hello everyone, my name is Wendy Lynn Jamieson and my informative speech is on effective healthcare communication. It is to inform everyone of the importance of healthcare communication. Effective healthcare communication is how healthcare professionals stay up to date on a patient's status and condition and medication. It is how healthcare professionals provide understanding to patients about their status and condition. I have obtained a home health aide and nursing assistant certificate. I have worked in the healthcare field for 16 months and have been taking medical assisting courses for about 17 months, in which I have gained knowledge and experience that is not limited to healthcare documentation, law, ethics, and glucose and vital sign monitoring. My visual aid is the Littman 3 stethoscope. It is two-sided and used on both pediatric and adult patients. This stethoscope is a tool used in healthcare that allows healthcare professionals to listen to normal and abnormal sounds of the body, such as the heart, lungs, and bowels. It is also used to help healthcare professionals to communicate effectively by documenting and announcing the patient's vital signs and the normal and abnormal sounds of the body to the healthcare team and when addressing the status to the patient. Tony Robbins states, "The way we communicate with others and ourselves ultimately determines our quality of life." Effective communication in healthcare is delivered both verbally and in a written form from both the healthcare professionals and the patients. It is critical for the healthcare team to stay up to date with each other on their patient status. Through effective updated documentation and verbal communication, healthcare professionals must speak clear and concise with perfect pronunciation when speaking patients' names, medications, and using medical terminology. Just as speaking, documentation must be clear and concise as well. Medical terminology and abbreviations can be tricky and confusing, whether it be spoken or written. It is always best to get reassurance, and there is the saying, when in doubt, write it out. Lack of effective communication among the healthcare team can result in lack of documentation, treating the wrong patient, providing the wrong medication and dose and flow rate, the wrong time and route. That is life-threatening. For healthcare professionals to effectively communicate with the patient, they must be empathetic, show concern, and be quick to listen and slow to speak. Through this, more patients will be more willing to be open and honest. Less patients would lie about alcohol or substance use, which could potentially cause an adverse reaction, an overdose, or death. More patients would speak up when they had questions. If they were to be released without understanding their condition or a prescription, they could worsen their condition and overdose themselves, which is life-threatening. For those of us enrolled in the medical assisting program, it is our duty to provide comfort to the patient and make sure they are informed. Just as we are supposed to study their body language and appearance, they will study ours with that, and our eye contact are other forms of communication as well to keep in mind. Speaking medical terminology will eventually become a second nature to us and will become a habit that should not be used towards the patient. However, we are to help the patient understand questions they have of medical terminology and their condition and any other information they need to know. We can help by going over their paperwork with them, use visual aids, pamphlets, and print off and go over further information for them to take home In addition, we are to triple check our patient's name and date of birth through the EHR system, talking to the patient and the patient's wristband. To further communicate effectively and provide quality care, we are to go over the patient's family and medical history, providing medication and preparing for procedures, informing the patient of the medication they are given, the dosage, and why they are receiving that medication. When preparing a patient for a procedure, we inform them of the procedure, why they will be going through the procedure, and we will talk them through the procedure. Effective communication in healthcare is critical, both verbal and written form, for both the healthcare professionals and the patients. These forms of communication can be compromised due to lack of documentation, understanding, comprehension. However, it can be prevented through effective healthcare communication. Without effective healthcare communication, patient satisfaction and quality of care decreases and is life-threatening. Thank you for listening to my informative speech on effective healthcare communication. I hope y'all have a blessed day.